back. Happening right now, the Southern Nevada Health District is speaking about the coronavirus pandemic. We do have it up for you, so let's go ahead and listen into what they're saying.
That process, basically.
Yes, the Southern Nevada Public Health Lab is working very closely with the state lab on validation of optional kinds of tests. So that's currently underway, and the state lab is also working on manufacturing collection kits for use in testing. So we got off a call this morning, and they're working on that, hoping to produce up to 1,000 a day when they get fully operational.
Okay, we have a question here from Art Kane from the RJ. He says, why has the Southern Nevada Health District been so reluctant to say how many tests they have and need? Clearly, if you're asking the feds for tests, you should know those numbers.
Well, the Southern Nevada Health District has not been reluctant to express our need for the lack of tests. We've expressed it continuously to the governor's office and to the federal government, to the CDC and FEMA for our needs. We've been promised by FEMA multiple times the delivery of tests and personnel to help conduct such operations as drive-through swab pods and so on. So currently, our testing capacity, as I mentioned, is 40 a day, and we're running very low on the extraction kits that are used in testing right now. We have about 119 extraction kits left currently.
Okay, this is a reminder to anyone who's calling in. If you press *9 on your phone, you'll raise your hand. Got another question here in our chat box from Roni Acosta from Fox 5. How long does it take for results to come out when people are tested?
I mean, typically the turnaround is 1 to 2 days, but as I mentioned, as more testing is happening and with fewer resources, turnaround times can be a bit longer. Kim, would you like to add?
Yeah, I would just like to add, it can depend on the test or on the laboratory that's running the test. So some of the commercial labs have been inundated with samples, so their turnaround time has become a little bit longer. So we are seeing turnaround time from some of the commercial labs upwards of 5 to 7 days.
Okay, let's jump back up to a phone question. Phone number ending in 2962.
Hi, it's Dana Gentry from the Nevada Current. I have a couple of questions. Has the health district conducted ILI specimen testing during flu season?
I mean,
So this is Kim. I'm sorry, I don't have a lab representative here, but typically in past seasons, our Southern Nevada Public Health Lab has been involved in some ILI testing, but it would be a small subset of our community. Currently, or in previous years, other providers within our community have conducted ILI testing and submitted that data directly to the CDC. I don't have the amounts or the numbers in front of me.
no,
Here's another question from the chat. Jacob Solis from the Nevada Independent. Is there a sense of any trends in the hospitalization data, especially as it has decreased over the last few days, or is it still too soon to tell?
it's really too soon to tell. We are tracking that, but hopefully we'll know more, as time goes on here.
Okay, here's another phone question. Phone number ending in 7309.
Hey, Michael again from the Las Vegas Review-Journal. Two-part question. The first part being just, is that data that you mentioned, the expanded data, going to be released today, or should we expect it next week? The second part about the 119 extraction kits, approximately how many specimens can each extraction kit extract from? Is it 1-to-1, or is it a bunch of specimens for one extraction kit?
I'm sorry. The first part of your question was, when will the expanded epi profile be released? That will be today, I believe. Yes. And I'm sorry, what was your second question? Sorry.
He wanted to know how many samples could be tested with an extraction kit?
One, essentially.
It's 1-to-1.
It's 1-to-1. If your question was, you know, it's 1-to-1 as far as extraction kits and swabs.
Here's another question from chat from Mike Brunker. Can you share any information?
All right, so you were just listening right now to a telebriefing from the Southern Nevada Health District. Pretty much a Q&A for the most part there. We heard them talking about the manufacturing collection for some of those kits for testing. Also, they mentioned promises from FEMA for delivery of drive-through swab pods. Also talking about how they are running low on extraction kits. We're going to continue to follow this for you and give you any updates that we gather from that Q&A. But again, that coming from the Southern Nevada Health District this morning. And of course, we'll have more for you in just a little bit. But right now, we want to get to the numbers here in our state.